Hi everyone, my name's Dr. Rachel Corman. I'm the feline specialist here for Veterinary Specialist Services. And this is just a short video to demonstrate how to use a inhalational chamber for your cat. So generally, if we're recommending this for you, then it means that your cat has asthma or chronic bronchitis. And so if you have any other questions about these diseases, then please don't hesitate to visit our website or alternatively contact us at the clinic. So there's a couple of different types of medications that can be given using these chambers, and basically these are all human drugs for human asthma patients. And we have this one, which is called fluticasone, and it's generally an orange coloured inhaler, and this helps to reduce inflammation within the lower airways. So this is a very important long-term medication for most feline asthma patients. The next medication is this one, which most people would know as Ventilant, and it's a drug called salbutamol, and it's what we call a bronchodilator. So it helps to open up the very small airways in asthmatic cats that can get very, very narrowed and constricted. And so this is a medication that we will often use when cats are having an acute onset deterioration with their breathing, but it's not one that we tend to use in the long term for these patients. So if you have any questions about dosing or how frequently you need to be giving these medications, then please don't hesitate to contact us at any time. Now, this is our little patient Snow. She is our model for today, and she's never actually had this procedure done before, so she might be a little bit reactive. And that's really, really common when you're first starting to do this procedure with your cat. And so a really important thing is just to stay nice and calm and nice and cool, and just do everything that you can to reassure your cat. And what you'll find is that, if you do things like leaving the face masks, for example, next to, your cat's sleeping areas, or next to their food bowls, just so they get used to the masks being around. And as with anything cat, if you introduce these changes really slowly and really calmly, then the cats are going to be more likely to accept them in the long term. And most cats will be really, really tolerant of this procedure over time once they're used to it. All right, so firstly, with the masks, depending on which system you use, this is an AeroCat system, and these can be purchased online through veterinary pharmacies or direct from the website. And they will generally come with 2 masks. And you want to choose the mask that gives you just a nice tight seal around the cat's muzzle. So just like that. Snow's a really tiny cat, and so we're using the smallest one here. And it might just be, for the first couple of sessions that's all you do, is just literally holding the mask on her nose like that. Let her take a couple of breaths, and then you can give your cat a little reward. Good girl. All right, so to connect it up, you just push that in here, and the medication goes into this section here, like that. So you might have 1 puff or 2 puffs, depending on what we've recommended, and it's important to do each dosage individually. So for example, we do 1 puff here, like this, and then we introduce the mask like this, and then we hold it onto the cat's face for about 5 to 7 breaths. Good girl, Snow, you're very good. And just remember, this is the first time that she's had this procedure done. There we are, darling. Good girl. Now, what you don't want to do if you've got a patient who's having 2 puffs of their medication is to do 2 puffs directly into the chamber like that. You want to do them separately if you can, so that the cats get the complete dosage. What you can see with this chamber here is there's a little green valve in this section here. And every time the cat takes a breath in or out, you'll see that this little valve will move backwards and forwards. So ideally, you'll count the movement of this valve forward and backwards for about 5 to 7 breaths, and that will make sure that the cat has inhaled all of that medication. Once they've completed their medication doses, it's important to give them some treats and some positive rewards, so that each time that you have to do this, they'll just get more and more relaxed with the process. One thing that's important to do as well after you've finished is just to give their face a little wipe like that in case there's any residual medication. Sometimes the cats can get a little area of dermatitis just over the roof of their, over the top of their nose, where the mask has been sitting, and where you might get some interaction from that. So just give their face a little bit of a wipe after the dosage. Each chamber will come with individual recommendations on how to clean the chamber and how to dismantle it. And generally it's just to wash it with warm soapy water and just make sure that it's standing upright to dry. So hopefully this has been a useful video for you. And like I said, most cats with time and a little bit of effort with their training will tolerate this therapy very, very well. If you have any questions, then please don't hesitate to visit our website, or alternatively contact us at the clinic at any time.